So do you know that for some women in pregnancy, for the very first time, they experience what we call piles or hemorrhoids? Let's not get ahead of ourselves. What do piles or hemorrhoids mean? Piles refer to swellings of the rectum. Remember that at the buttocks, where physics comes out from is the anus, but just before that is the rectum. So there can be some swellings there that contain blood vessels that enlarge, and then it sometimes it is felt like a swelling or a protrusion through the anus. So woman finds that, oh, she has used the loo, she has defecated, but still feels like there's something there, or even this protrusion, even feel it coming out. There may be an obvious swelling there. For some other women, they may find that there's just some soreness around that area, or itching, or it may even be that bright red blood is seen after using the loo. So it becomes a concern because, I mean, this is strange. I've never had this before. What's happening? Piles can happen at any time. It can develop at any time, not just within pregnancy. But when it happens in pregnancy, what accounts for it occurring in pregnancy? Number one, the uterus is large because the baby is getting bigger. So as the uterus is enlarging and the baby is getting bigger, the space in the abdominal cavity is reducing, and it seems like everything is being pushed down. So that is one factor. Number two, a hormone of pregnancy, progesterone. This progesterone in pregnancy is multiplied in many folds, and it tends to slow things down. And that slowing things down can worsen constipation, and constipation on its own can worsen piles. So all these things contribute, because when there's constipation, then there'll be straining, and with straining, the piles get worse. Also, standing for long periods of time or sitting for long periods of time can also worsen that pressure, contributing to these piles occurring in pregnancy. But the good news is for most women, after pregnancy, by the time baby is born, those symptoms resolve for most women. In cases where they persist, there are remedies for that. But meanwhile, in pregnancy, most times, what we do is really conservative for the piles. There are things you can do at home to help. Number one, if your work involves a lot of standing, are there ways that it can be modified so that I get to sit at intervals? Because that would really help when you're able to alternate standing and sitting and not doing either one for long periods of time. Number two, you would have to modify your diet so that you have more of leafy vegetables, fruits that can get your guts moving, that can get your bowels moving so that you don't get constipated. And then taking lots of water. You may be complaining, oh, I already pee a lot. How do I start taking more water? Well, you need to take water so that you hardly get constipated. So fruits that would help get your guts moving: oranges, cucumber, pawpaw. This, depending on other fruits you have in your country. So this would help. Also, avoid straining. If you get constipated, that is when you're going to strain. And with pushing, that force makes the power worse. So try not to strain. Also, something important is when you feel sore, you can use a towel soaked with warm water to pat that area for comfort. And then if you use the loo, instead of using dry tissue paper, consider using wipes so that it also gives some soothing effects to the pain and soreness there. And then once in a while you may see blood, but if you see blood, it's good to also inform your doctors. And then even for that protrusion, tell your doctors they're going to work with you and manage it through the period of your pregnancy. And as I've mentioned in this video, for most women, that symptom will go away after pregnancy. But if it doesn't, there are other remedies that can be used for you too. So I hope you gained from this video. Feel free to ask your questions and see you in the next video. Thank you.